Good afternoon, everyone. This is the Vermont House Committee on Commerce and Economic Development. It is Friday, May 1st, 2026 at 5 in the afternoon. Here to continue more discussion and testimony on S71. Yes, so thank you for doing it.
Thank you very much for having me. Jessa Barnard, I'm the Executive Director of the Vermont Medical Society. We are a physician and physician assistant membership association. But this afternoon, I'm wearing a bit of a mixed hat. I am also here on behalf of a coalition of healthcare associations. We began meeting regularly during COVID to plan COVID response and better coordinate as a healthcare system. And we've seen the benefit of us being stronger together and making sure we have really good communication between all sorts of healthcare organizations in the state. So I've submitted a comment letter or memo on behalf of a number of healthcare organizations. It's myself at the Medical Society, Planned Parenthood of Northern New England, the VNAs of Vermont, the Visiting Nurses Association, Vital, Vermont's Health Information Exchange, the Vermont Association of Hospitals and Health Systems, Vermont Care Partners, our designated agencies, Vermont Healthcare Association, which are long-term care organizations, Bi-State Primary Care, that's our federally qualified health centers, Health First Independent Practices, who you'll also be hearing from later this afternoon, the Vermont Nurse Practitioners Association, the Vermont Academy of Family Physicians, American Academy of Pediatrics, and the Vermont Psychiatric Association. So we are trying to not all have to get in the chair, but we are submitting our comments together. I have a couple of my colleagues here with me in the room because depending on how tough the questions are you ask, I may need to phone a friend, but I will do my best to kind of present testimony together. So not only what brings us together are being the healthcare providers for Vermonters, but we are also all HIPAA covered entities. So we are covered by federal privacy law. I will say we talk a lot about HIPAA, but well before that, healthcare organizations are founded in privacy for our patients. We understand that patients won't share their information with us if they don't think that their information is being kept safe, being kept confidential. It's the foundation of what we do. It goes to the beginning of medical practice. It's to the Hippocratic Oath and our codes of ethics as for our members who are providers. So even before HIPAA, there was well-established confidentiality and privacy protections for healthcare information. And because of that, and because of the comprehensiveness of HIPAA, which I will talk about a little further, we do not support the current draft of S71. We do support S71 as passed the Senate, or we are also comfortable with we've heard of talk about the Connecticut amendments, and that is because they maintain an exception for an entity level exception for HIPAA covered entities. I want to just spend a minute, and I will try not to spend too long on this or bore you, but I want to outline a little bit what HIPAA covers. And I want to do this because I think you'll notice a lot of familiar concepts and terms because it is very similar to the structure that states are looking at for their comprehensive data privacy laws. I would guess that this is just a complete guess, that is not an accident, that we have learned from things like comprehensive healthcare data privacy, and we are trying to apply that in other contexts. So what do healthcare entities, HIPAA covered entities have to do? You've probably all seen these when you go to your doctors or dentists or other office, a notice of privacy practices that talks about how your information will be protected and how healthcare entities can use it. Patient authorization for many uses. So when if there's anything beyond treatment, payment, and healthcare operations, you need signed patient authorization. All of our data needs to be kept to the minimum necessary. So we know there's also a similar somewhat similar structure in consumer protection laws, employee training, applying HIPAA requirements to business associates. So we know we don't just keep our own data, but that maybe our electronic health record vendors or our billing companies may be also getting access to, again, that very sensitive healthcare data. By being a business associate, that really applies all of the same HIPAA regulations to them. They are agreeing through that contract. They are now also covered by HIPAA. There is quite extensive guidance from Health and Human Services, who I will talk a little bit more about this, but enforces the HIPAA privacy law that tells covered entities how HIPAA applies to websites and tracking technology. There is enforcement for HIPAA. The Office of Civil Rights in the Health and Human Services has imposed civil penalties for HIPAA violations. They have a whole website that I've linked to, which lists who they've penalized and what the amounts have been. And there are breach notification requirements. There have been, so HIPAA has gone through several iterations, and there have been additional sections of rule. There's an entire section around security. So that's more about the electronic transmission of the data, and around notification of breaches, a whole separate rule on breach notification. The Vermont legislature, your colleagues a couple of years ago considered what or how to put health information privacy law in Vermont law, and they determined that HIPAA was sufficient and protective. So 18 VSA 1881 adopts HIPAA as the standard for healthcare entities in Vermont. We are also, many of us, subject to additional federal regulation around substance use disorder information. That's 42 CFR Part 2. And I think it is the more I have tried to wrap my head around how the current exemption, which is a data level exemption in S70, your current draft of S71, would work for HIPAA covered entities, the more complicated I've actually discovered it to be. Because what is in current draft 2.3 says that protected health information, which is a term of art, a defined term in HIPAA, is what is exempt, but not the organizations. It is very hard to parse how that will work with the rest of the scheme of the law, which applies to consumers, which is not actually a term we really use in the healthcare world, but I think it's a little unclear how that applies. And I will give you an example of this. The bill's current application standards say that the bill requirements apply to all controllers that possess even one consumer's sensitive data. I know you've talked about that a lot, and I believe you've also talked a lot about sensitive data includes healthcare data. So by definition, every organization that signed this letter is subject to the law because we all have healthcare data that is sensitive data. It will apply to us with no exception. Yet another section of the law says that certain types of data are exempt from that. I will give you an example of, this is how I've had to think of some hypotheticals to parse how I think this might work for our members. I will give an example. It's also personal to me. I was visiting my father in a long-term care facility over the past year. Every time I went, I had to sign my name and take my temperature for contact tracing purposes in case I brought an infectious disease into that long-term care facility. I'm not a patient of that facility. So that is not HIPAA protected data, but it is healthcare data that now will be on a piece of paper in that organization. Who does that entity now give a new notice to under your law? It says consumers, just those people who have signed the sheet, every patient who also gets a HIPAA notice, who also has all the HIPAA protections applying to their data. It is not clear. I read that currently we would have to give that notice to every Vermonter who touches our organization. The way I see consumer would be every patient. So they are now getting double sets of notices, a HIPAA notice and a notice under this law, even though the notice under this law would not really apply to the patient data. Patients have a very different set of rights around removing or changing any data in a healthcare record. Patients have a very different set of rights around requesting access to their data. So it is just very complicated to overlay a data type exemption with a law that applies to consumers at large. I'm having a really hard time seeing how they can work together. And the way I read it is it basically would require all of our members to apply two sets of notices, policies, procedures, employee training, all of the requirements of the law. We've seen how confusing it is for consumers when they're getting, or patients, when they're getting double notices. There was a time where HIPAA and the substance use disorder law, 42 CFR Part 2, had similar but unharmonized requirements. And that led to a lot of frustration for patients and organizations talking to each other. The federal government amended 42 CFR Part 2 to harmonize with HIPAA so that those requirements were more similar. This is also going to lead to, and I know you've heard about this from other types of entities, but healthcare in particular, extremely high compliance costs, because we will have to parse every type of data we manage and figure which are exempt under this data type exemption versus which are not. We have heard we know you've heard examples of maybe $20,000 to $40,000 for a small organization to comply. I cannot guarantee this, but I am fairly certain that that did not include a comprehensive analysis, organization by organization, of what is HIPAA data and what is not. That's sort of your general small business in Vermont, not a very complicated organization that has HIPAA covered data. You already know healthcare organizations in Vermont are running at a loss. You already know we're losing small providers. We're losing primary care practices, health insurance premiums. I am sure you have all heard from your constituents. This is not a time we can put more compliance costs on Vermont healthcare organizations, especially when we have heard no examples, I will say, of how healthcare organizations are not adequately protecting consumer data, their patient data under HIPAA. And we think this basically leads to a double tax on small businesses. Not only are small businesses having to come in compliance themselves, I'm just talking about non-healthcare businesses, but now they're going to have to pay higher premiums for their healthcare provider, which they're already paying for their healthcare insurance, to now have their healthcare providers come into compliance. So we respectfully ask that you look at S-71 as passed the Senate in terms of their exemptions, or as I mentioned, Connecticut still includes a entity level exemption in their amendments. Our neighbors in New Hampshire have an entity level exemption. We know there are a lot of cross-border healthcare providers in Vermont and having a similar structure. So we know what this means. We know how to interpret the terms. We know how the exemption works with our neighbors, would certainly make much more sense from our perspective. So we ask that you keep those exemptions from the Senate. Yeah, happy to answer further questions.
Thanks, Jessica. Just for disclosure, I sit on the board of Orleans Essex VNA, so want everyone to know that. Edie?
Thank you. Appreciate you being here today. Appreciate all the conversations to help us understand, and really appreciate the situation that our hospitals are in today in Vermont, and our medical, our insurance industry, all of that. It's understand it's a huge issue right now, and to be talking about this at the same time adds what probably feels like unnecessary stress, and we appreciate that you're here at the table with us during that. My question is around data that is not covered by HIPAA. What could that be? Like what is the need for an exemption for what data? That's the question.
Sure. I'll try to maybe explain a little more slowly the example that I tried to give around a visitor to a healthcare facility having to, for example, write down their temperature. So that individual is not a patient of that healthcare organization. They are not there for treatment purposes. So that is not HIPAA covered data. So now if 10 visitors come in that day and write down their name and temperature, so that if there is a problem, if a patient is exposed to COVID, flu, whatever, and we want to trace who was in the building, that data the exemption wouldn't apply to it. And as I read it, since that is sensitive data, that organization, all of the requirements of the law now apply. They have to have policies, procedures, opt-out options, employee training.
If that data is collected.
Correct. If they write that on which they need to do because they need to be able to follow up if that individual, if there's a problem. Now this patient is testing positive, this person they visited is now testing positive for COVID. We want to contact trace and find out if the visitor has COVID.
Could it also cover data if the location is using Wi-Fi? Could that location be collecting data on the people coming into the building, on what sites they're visiting?
I don't know the Wi-Fi question. I do know in terms of websites that the Office of Civil Rights, Health and Human Services that implements HIPAA and enforces HIPAA has put out extensive guidance in terms of healthcare organizations' websites and what is or is not allowed to be collected via that website. And it's very, I printed it out the other night because I wanted to refresh myself. It is very detailed in terms of when is a patient, for example, when is somebody visiting that website, for example, identifiable, or when is their healthcare information identifiable versus when is it not, and when can you track anything or not. So it is that situation is covered. And I also want to be very clear that I say it's something like a patient portal where you are logging in and entering patient information. That is absolutely must be covered by HIPAA. If you are working with a third-party vendor to provide that service, they need to be a business associate and also follow HIPAA.
I'm more thinking about, when I've had family members in the hospital and I'm sitting by their bedside and I'm on the Wi-Fi and I'm working or I'm, doing other things. Can I be tracked? Can the information that I am accessing on that Wi-Fi, does that entity have the right, if we give this exemption, have the right to capture that data and use that data? And so
I
that's,
would anticipate I can clarify that. If I'm wrong, I will come back with you with different, the way I would think through that is that healthcare organization is not their own Wi-Fi provider. They are working with some other Wi-Fi provider that probably would not be exempt and would have to follow this law if it goes into effect.
so it wouldn't be considered an affiliate, right? Like this
I
is.
don't think so. To be a business associate, you need to have a business purpose to be accessing that entity's protected health information. I don't think a Wi-Fi provider, unless they're providing some other kinds of services. So it's either one or the other. Either they can access protected health information and you have a business associate agreement with them, and then they have to follow all of the rest of the HIPAA requirements, which would not allow selling of your data or tracking of your data, or they are not a business associate and they would fall under this law.
Thanks for coming in to talk to us. So, I get your concern that you have this regulatory regime that protects the information that are covered in the practice hospital. They need to take care of the patients, and it's, lots of rules enforced, hopefully well enough. But my question, so 2.3 would apply unless there's an exemption. And so I'm getting into the exemptions here, and there's a long list. Many of them relate to health. And like you say, I think you said there's an exemption for protected health information under HIPAA. And then you got the alcohol substance use issues information, public health, exclusion. And then the next one I think is maybe relevant to the example that you gave. Information that is a health record, as that term is defined by 18 VSA 4919. And I'm looking over at 9419. Yeah, 9419. And it's a pretty broad definition. It says healthcare record means all written and recorded healthcare information about an individual maintained by a custodian. To me, in your example, care facility of some sort, and a visitor's coming in, and they're going to record some health information. What's your temperature today, right? I'm not sure why that particular example. There might be other examples too. Why that wouldn't be covered.
I would not think that is considered a healthcare record because that is not a patient of the facility. That is a guest, a visitor, and it's not maintained over time.
Yeah, but I don't see the definition in 9419 as being limited to patients. It talks about individuals. It's intended to be very broad.
It is very broad. This is actually, it's a curious cross-reference actually in my mind, only because if you look at where the statute's coming from, it's actually about charges for access to medical records. It's not really it's not really a frequently referenced definition for other purposes in state statute. I don't know any of the history of why that exception is included, to be clear. I agree with you. It's written very broadly. I don't think a healthcare organization would feel comfortable relying on a statute about charging for access to medical records to say that information about a non-patient is a medical record.
Well, I could imagine you taking, skip the cross-reference, right? Just put it right in. because that's the intent. And I'm thinking also, if there's any uncertainty about whether or not that kind of a record about temperature, or similar kinds of things, right, is not included in the definition, which to me is pretty bad. You can make more specific. So I mean, I see it as, unfortunately, as a matter of, that's a simple fix in terms of crafting. I mean, because I think we're trying to exclude the type of records that practices keep. And I think that was the intent.
I'm not really clear what type of information we're trying to include from healthcare facilities, to be clear. I'm not sure. I have not heard any example of a healthcare organization in Vermont not adequately protecting healthcare or other information.
And I wouldn't want to suggest that any of our practices, would be thinking like that. We have some pretty large organizations, though, and I don't know, their focus obviously is on healthcare, but they're big organizations.
I think regardless of how you parse it, it is going to take an organization by organization assessment of any type of data they may have that may not be protected health information under HIPAA. And then if they have that, how they reconcile that with following a comprehensive scheme that requires notice, policies, and procedures for every consumer who touches that organization, when those requirements are really duplicative but not consistent.
But not if it's excluded.
We have to know every piece of information that every organization might have that we want to include. I don't know how to prove it. I don't know how to adequately craft an exception that's inclusive enough without excluding the entity.
Okay, fair enough.
Yeah, thank you. I guess I just have a couple questions. The first is, we had somebody testify the other day about like a previous exemption that was a data level exemption, but it was if the entity is covered by HIPAA and is treating all of its data at that protection, then that's basically, it's kind of like a data entity thing. Just curious if you would support that.
I spent a lot of hours over the past couple of days trying to wrap my head around whether I could get on board with that, whether that could be workable. And I hate to ever disappoint a committee, but I don't see how that works because of how HIPAA is. All of the HIPAA requirements are very specific to that term of art of protected health information. So which relates to a patient's historic, current, or future healthcare needs. So let me just go back to this example of the visitor recording their temperature and writing that on a piece of paper. That is not because of their relationship with treating that person's future, current, past healthcare needs. All of the notice that would go to you would now say, I have the right to use your data for treatment purposes, healthcare operations, billing. None of that actually applies to you. So you'd come in, you'd be writing your temperature down and now have to get this HIPAA privacy notice that says you're a patient of the practice and I can use your information for treatment, payment, and healthcare operations. You would have the right, all the HIPAA, like the HIPAA is just crafted so specifically for such specific types of, the policies and procedures around how you treat patient protected health information. I don't see how we sort of shoehorn other types of data into HIPAA unless we rewrote all of those policies, procedures, forms, in which case we might as well be following a completely different compliance regime.
Thank you. Thank you. And just so the exemptions themselves were crafted with several different HIPAA privacy and security compliance consultants that do this to protect hospitals and things like that. And they had a health emergency this week, so hopefully we'll get them in. There was definitely a lot of time spent trying to thread the needle for sure. And I guess a question for me for areas that are falling outside of this, for instance, like I went to UVM Medical site. I was trying to pick members, but UVM Medical site, the North Counties Healthcare site, the Vermont Medical sites, the refugee health site page in particular, Vermont Wellness Gender Affirming Care. None of them offered me opt-outs of being tracked, and all of them are using Google Tag Manager. And that has been like over and over cited as a example. And I don't like in the past, I've seen CallRail being used and other examples of trackers that are installed on Vermont's kind of HIPAA covered entities that are basically having information. So if I go to look for gender affirming care, or if I go on this Vermont Medical Society page and look up refugee health, and then that gets added to my profile for Google, and then that gets added into the real-time bidding markets, and then data brokers join that, and they're buying my profile that I am potentially a refugee. And then that is being then ICE, that is being sold to ICE. And then that is potentially putting refugees at risk and or other immigrant populations. The same for gender affirming care, the same potentially for abortion access, the same for cancer patients. So I'm just like curious, maybe if these entities are not thinking about like what we're trying to, I totally heard that the transactions related to insurance, the HIPAA is an Insurance Portability Act, right? It's not actually a privacy act. It is in relation to, I mean,
Privacy and portability.
sure, but like, yeah, but it's, yeah, I mean, it was created for being able to share the insurance, right, with insurance companies. So one, like there's a gap there for, that is in those transactions with the insurance company, with the provider, that kind of stuff. But an area that's not protected is like the website and all the sites that I'm looking on. And then also like, I'm curious which sites might be using AI chatbots or automated call systems that are like now using AI to make appointments. And a lot of those are not covered by HIPAA. They might be treating the data at the same level as HIPAA, but they're not HIPAA in like inherently HIPAA entities covered. And then also just thinking about connected devices that a hospital might be giving out. So all of these areas, but also, I mean, I feel like in a lot of cases, especially in this moment in time, donors are not protected at all, and potential clients who don't have a relationship with the hospital. And so really curious if those things are protected. Yeah.
Okay.
Yeah.
That's a lot.
Yeah.
If you have time, I can go through those.
Yeah, no, I would love.
Okay, good.
Yeah.
So websites, so
Yeah.
any websites. First of all, I just want to be really clear. Some of us are not HIPAA covered entities. Vermont Medical Society,
Sure.
my
Yeah.
organization, I am a membership association. I'm like the Chamber of Commerce.
So you wouldn't be
or-
exempt.
So I would not be exempt.
Okay.
However, actually, I have the benefit of a 35,000 record exemption. Healthcare entities which have sensitive data do not.
Sure.
So actually, every other nonprofit in Vermont under this scheme or the current draft actually gets a pass of up to 3,500 consumers. Healthcare entities that have one piece of sensitive data get none.
Oh, yeah.
So that's actually,
Nonprofits.
so it's actually, well, I mean, right? So I'm just, that's a policy decision.
Sure.
On top of that, banks, insurance companies, state-run healthcare facilities are getting entity level exemptions. I think that's fair. I think they follow comprehensive federal privacy schemes. I think we do as well. Our members, not my association, our members who follow HIPAA. So some of those websites they will have to fall under whatever thresholds you consider for every other type of organization that's not exempt. The HIPAA covered entities should be following OCR's use of online tracking technology by HIPAA covered entities guidance. If they are not, individuals should and can file complaints with the Office of Civil Rights, and they investigate and they enforce with penalties.
So that's a law, not just like a set of rules that are like a suggest. I don't know anything about it. So.
It is guidance, but I believe it is enforceable guidance. I mean, it is based on their HIPAA's
Yeah.
law and rule and guidance. I think it all is legally required to be followed.
Can you check? That would be great to know.
Sure.
Like,
Yeah, I would be happy to. Yeah, I'll see if this gets into enforcement of the guidance, but typically my understanding is federal guidance is part of any kind of regulatory scheme and must be followed. Chatbots. I think it would again depend. Some of those may not be. So we know there are autonomous chatbots out there doing all sorts of things which are not HIPAA covered entities. If that is run by designed by, shared information by a HIPAA covered entity, they better have a business associates agreement with that company running that chatbot, and that entity better be following HIPAA, or else again, file a complaint with the Office of Civil Rights. They should investigate, they should enforce. So there's, chatbots are and are not in HIPAA. The donor list, I will come back to what I said at first. The current draft makes the policy decision that other nonprofits out there, unless they're keeping credit card information, can have a donor list, can have up to 35,000 Vermonters in their donor list and keep that information. Healthcare entities are actually being disproportionately burdened by saying they cannot, because they also have one piece of sensitive information. By definition, they will have healthcare information.
A question that, so on the entity level exemption itself, so you're only asking for HIPAA covered entities, not like providers that aren't taking insurance and then wouldn't be covered under HIPAA?
Correct. So actually, let me come back. Actually, I do want to add that I don't represent them, but I think just from a healthcare system mindset, it's actually would be problematic to not also include business associates. So HIPAA covered entities and business associates who are following HIPAA, because otherwise I'm just concerned. I want to think about that one a little bit more, but that's the way the language was in S71 as passed the Senate. And I think if you get into HIPAA covered entities, but not their electronic health record vendor who is following HIPAA and acting as if they are a covered entity, you could get into problems with important healthcare data sharing between them. But I need to think about that one.
Yeah, I would love to if you could provide specific kind of language, because if we did HIPAA covered entities and then business associates versus business associates that are treating their data as if they were HIPAA covered, like those are two very different things, right?
It is not, because by definition, it is a term of art under HIPAA to be a business associate, and it is very clear that you are agreeing in your business associates agreement, you are following HIPAA. You have all the same, you have to maintain all the same security, same privacy, same rights of really the distinction between the two is a little bit about who notifies the patient if there's a breach. There's still breach notification in either case, but it's a little bit of like who holds the requirement to do that. Is it the business associate or the covered entity? That's why there is some. And just again, it's just because by definition, the business associate is not the healthcare provider. HIPAA only applies to HIPAA itself. HIPAA covered entities have to be a healthcare provider. The business associate is the entity providing services to that covered entity, but they're covered by all the same requirements.
Clarifying question on can you give us an idea of the realm, and thank you, this is helpful, but give us an idea of the realm of business associates. Like if you're using, say, like a Ring or a Tracker or something, that there's a contract with the hospital to give to patients, is that entity, say it's Apple or something, they're giving patients Apple Watches to track their blood pressure. Is Apple or Google or anybody else has connected devices then exempt?
In the case, so a business associate is someone who the covered entity itself has a business purpose to give their patients' healthcare data to that entity. Right. So if the healthcare office, so let me give you, so if it's saying, I want you to have a blood pressure device, you take this home and I will get your blood pressure readings back to me. And I'm getting that data, you're giving that data. I would think that provider of that blood pressure cuff in that case might be a business associate of that healthcare organization. If the provider never gives any of their data, or say they just say, hey, we think it might be a good idea for you to go out and get a smartwatch and track your steps.
No,
right?
I'm talking about contract.
Like then they'd have no contract. They're just recommending to their patient, maybe you want to get this thing. We're not sharing any data. It's really about a business purpose to share that organization's healthcare data. That would be the business associate. So I think with wearables and devices, it's a little bit complicated is there any further information sharing from the covered entity, or is it just from the patient? Like if it's the patient can give the patient has the right to give their information to anybody they want to or choose to, or any device they purchase. Like for example, I have a insulin pump that I can plug in and communicate to my provider, but my provider hasn't said, send me, this is my information, not their information. They're not sharing my medical record with a third party to analyze that information.
Questions for Jessup? Thank you.
Thank you very much for your time.
Thank you.
Listening to HIPAA on a Friday afternoon. Not everybody enjoys it as much as I do, so I understand.
Yes, very informative.
Thank you.
Afternoon.
Good afternoon. Thank you for the opportunity to speak with you all today. My name's Susan Ridson. I'm the Executive Director of Vermont Health First. We're an independent practice association. So we represent 66 clinician-owned practices across the state, with primary care and specialty care. And these are the types of clinicians that, hang up a shingle, they take care of generations of the same family. They're part of the fabric of our communities, practices like Georgia Pediatrics, Northeast Kingdom Hematology Oncology, Upper Valley Peds, Middlebury Family Health. So those types of practice, smaller types of practices. And I appreciate what this committee is working on. I'm a huge proponent of data privacy myself, and I opt out of every cookie that I can. And I will say that our practices take data privacy seriously, and they, as Jessa has said, and you all know, they're under HIPAA, and they take that responsibility seriously. We are in support of the Senate passed version of S71. We do have significant concerns with the draft that the committee is reviewing today. Mainly because we believe it'll add a significant amount of administrative and financial burden on our practices. And our practices simply do not have the resources to shoulder this burden, nor the means to get those resources. And just to tell you a little bit about how an independent practice works, a traditional independent practice, their only source of revenue is what they're being paid by insurance companies. So Medicare, Medicaid, commercial insurers. They really have very little to no negotiating power. They're small practices. We're in a highly consolidated market where, more dominant entities can command the rates. These small practices generally cannot. So when prices go up, and they have, we all know about the huge price increases in health insurance on the exchange. Medical malpractice has gone up. Some supplies have gone up. Reimbursements have not kept pace. And that has squeezed our practices. And every year we have at least one close. We've had 11 close since 2020. And it's all about this dynamic, this unsustainable dynamic. When I see a bill like this come down the pike, I think that's just one more whiff of air that's going to push a few more over the edge. And when those practices close, we all pay for that because these are some of the highest value practices in our healthcare system. They operate leanly and efficiently. Their prices are usually much lower. And when they go out of business, we're left with higher cost entities and fewer choices. And I am extremely concerned that this additional burden, which these practices, unlike some larger entities, they don't have IT departments and legal teams and a whole bench of administrative staff. They're really just taking on more when they're already incredibly burdened. The United Healthcare CEO was murdered because of some of the prior auth burden that exists on patients, and our practices are dealing with this kind of burden, an astronomical amount of burden, day after day after day. Clinicians are leaving. I don't know if anyone saw the Wall Street Journal article where American doctors are moving to New Zealand in droves. And in fact, a doctor in our network recently moved to New Zealand. They're moving to Canada, and Vermont's already facing a healthcare work shortage. So I'm just extremely concerned, especially if Vermont will have a more restrictive, more burden on on our medical practices than, you know, in neighboring states. I worry about the effect that this will have on our network, and all of us on healthcare pricing. So we strongly urge you to adopt the Senate passed version of this bill. Thank you for your consideration. We just want to protect independent practices.
Perfect.
So I share your concern.
Yeah.
I really do. I know the data. I know what's happening to our workforce for primary care. And that directly impacts the ability of patients to see, you know, primary care docs that they really, really need. And I would also add that every time we reduce access to patients, for patients, that's losing money for the healthcare system. That's causing more expense. And unless we find a way to beef up the primary care system, make it worth their while, reduce the burdens, try to get better access so we can lower costs, you know, we're going to be big trouble. As Patrick said, I'm thinking the intent of this 2.3, in my mind, has been to put down a broad number of exemptions. So I totally understand you if I thought that you would now be subject to, you know, this whole new regulatory regime, duplicate of HIPAA or whatever. But I'm looking at the exemptions, and they seem to cover, you know, HIPAA type data, personal data, substance, alcohol abuse, and then more broadly, health records, health information in general. So I'm having trouble understanding why those, and you know, you can tweak that language to make sure that the exemption fits, you know, what the practices are doing. I'm having trouble understanding what, I mean, people are afraid of things. You know, I totally get that. But I'm just understanding, I'm having trouble understanding why the exemptions don't fit the bill.
Well, honestly, you know, I'm not a technical person, so I'll just put that right out there. I'm struggling. To me, it seems like every practice will need to go through the exercise of looking at every piece of data that comes in and out. There's also the vendor management that right now is handled, you know, through the BAA. Now this responsibility would fall to each practice to manage those vendors and what they're doing with that data from what I see. I mean, but
It's probably an unfair question. You know, it is difficult trying to sort out, you know, what's exempted under HIPAA and then what this broader exemption is. So that I
Yeah, thank you so much. So it looks like Health First is located in Washington. So I'm kind of ask you about Mukilteo. No, different.
yeah, there's more than one Health First, we've learned.
Okay, so nothing to do with Washington or anything.
Vermont Health First, no, we're local.
Okay,
Vermont.
just local.
Yeah.
Okay.
Totally owned by our members.
Actually, yeah, I do have a question because I was, thank you, because I was starting to think about the fact of like, the My Health, My Data in Washington and how that I mean, they don't have a privacy law, so it was specifically trying to protect health data. And so that applies really just to the data. But there's a few provisions in here that that are in kind of like My Health, My Data that applies to health, that if we exempted broader entity level stuff, we would be exempting. And so the two that stuck out to me the most are geofencing. So we're saying that like when I go to UVM Medical or something, or say I go to an abortion clinic or I go to a gender affirming care, or anything like that, or pharmacy or anything like that, actually that's another question. That people can't track me. They can't know that I was there. They can't serve me at targeted ads. They can't track me from those services like across state lines because then we've seen that demos of that where people go to an abortion clinic from a different state, like in Vermont, and then they cross lines and that they're being able to be tracked. It's a different state's privacy law, but that's the concept of like the geofencing, and as well as the prohibition of on the sale of sensitive data. And so I guess a question for mine is like, are HIPAA covered entities in Vermont? I guess they would be susceptible if we didn't do this to, they wouldn't be geofenced, I guess. And then, or would they? I guess that's a question. And are any of them selling people's sensitive data? Because then they would be allowed to under this. Yeah.
Yeah, I mean, again, not being the technical person and honestly, I don't even know if the practices would be fully where they would need to go through and figure this out. It's more and I share your concern. I do feel like David, privacy is an important thing. My concern is just pushing our practices who are already on extremely thin margins, don't have a lot of workforce, to do one more thing. That's the concern of mine. Doesn't mean what this committee is trying to do isn't important. I
Totally.
totally recognize that.
Related question. As I started asking the question, it made me think of something. Are pharmacies, let's say that Walgreens and Kinney and Hannaford and any of would they be business associates and or HIPAA covered entities at all, and then exempt?
Not that I'm aware of it, our practices. I don't know. I mean, Jessica probably
I would love
knows.
to answer that question. That feels like a big one that I wasn't thinking about.
Pharmacies are covered entities. If it is a larger entity that also has a lot of other retail functions, they may choose to be a hybrid entity, in which case that organization has to choose which of their transactions are covered by HIPAA and which are not. For all of those that, if they want to be a HIPAA covered entity for all of their business, they have to follow it for all of their business. If they choose to be a hybrid entity, they have to really clearly delineate what of our practices are HIPAA covered and which are not.
So we are potentially, if we did the HIPAA covered entity plus business associates without any data level restrictions, we are potentially exempting pharmacies.
You would be exempting the HIPAA covered pharmacies. There was a version of language, another iteration ago on a similar bill, that was very clear about if it was a hybrid entity, it was whichever elements of their entity is the HIPAA covered portion of that hybrid entity. So you could clarify to that extent. That was 2 years ago.
Yeah. Actually,
That part is.
I guess that's a question though too. Yeah, and was it 121?
Yes.
Yeah.
So we did. So would the way that the exemptions were crafted in 121 that was in consultation with all of you guys, would those exemptions work? Okay, great. Thank you. Awesome.
The learning
Sometimes I want to get out of my chair sometimes.
Other questions for Susan?
Thank you.
Thank you.
Thank you. Appreciate the opportunity.
Desmond?
Hi,
Let's go.
everybody hear me okay?
Yes.
Yes.
Great. Thank you very much. My name is Jessamine West, and I live in Randolph, Vermont, where I work at the Kimball Public Library as a library technologist, basically helping people to use computers, devices, etc. This is a very different take than the previous ones. I will not mention HIPAA. So thank you for the opportunity to come talk to you. In addition to the work I do at the public library, I also do a lot of public speaking at library conferences around the world, and I've taught a workshop on practical internet privacy for the last 10 years. There's a link to it in the notes for this committee. So what I'm going to talk about today is based on what I've learned in my 20 some odd year history of helping people with their technology problems and questions, mostly in a library setting. I can basically help anyone use a computer better. So I'm here today specifically to give you a little bit of background on what an average or a low skills technology user experiences when they interact with technology and how they think about it. I'm an aggressive supporter of increased privacy protection for all technology users. I think S71, to the extent that I understand it, will help with that, and this is why. I come from a library background, and libraries themselves are also aggressive supporters of patron privacy. We do this through a number of ways, some of which is just patron education, some of which is data minimization, meaning we do not hang on to data that we do not need once we've completed a transaction. So if you check out a library book and you return it, once you return it, we just take it off your record because it doesn't matter that you had it, and that's a record that someone else could access if they had a warrant or there was a data breach or whatever. So patrons can make, if they choose, an affirmative decision to keep their reading list on the library catalog, but they have to opt themselves into that. We don't automatically by default hang on to their data for the most part. The default is privacy. So legislation has helped libraries in Vermont tremendously, including Act 150 was called an act related to Vermont's public libraries. This was in 2024, a couple years ago, which expanded the confidentiality of who was covered by confidentiality. We won't tell people about your books. It used to cover 16 and up, and then now it changes to users who are 12 years old and up. We think this is sort of important because teenagers often have information they want to access in the library that maybe they don't necessarily want to tell their parents about. This also matches with the way that medical records are also confidential for users 12 and up, not users 16 and up, as I understand it. So this helped us help our patrons. So I think that S71, it'll help Vermont, help people keep their personal data more secure, less able to be lent, sold, transferred, or just kept and used to compile sort of tracking dossiers on people who I assure you have absolutely no idea that their data is being used in this way or being collected about them. So data minimalization, meaning keeping less data once you no longer need it for your transaction or your business purposes, protects users in the event of a data breach. And I should also mention here that I'm one of the few people who sued Equifax, the giant credit corporation, when they had their data breach in 2017, back when data breaches were super unusual and people were really grumpy about them, as opposed to today where we just expect these letters in the mail. And I won that lawsuit in an Orange County court, which I'm pretty proud of and excited about. But it would really be nice if you didn't have to talk to the Civil Rights Commission when there was, data problems, that actually more of your stuff would be protected. So the great thing about the library legislation that I referred to earlier, it's pretty simple to follow and comply with. Obviously, there's some technology aspects, a little bit of tech that's involved, but it's not super technical to implement. It just brings standards, as I said, in line with the way they're handled other places. So I don't know if this is true for our state's data brokers, the people to whom this legislation would. Sorry. The people for whom this legislation would apply to, but a lot of our library workers themselves are very digitally divided, and they don't necessarily understand all the implications of something like, hey, we're a library and we're going to use Instagram to share photos on social media. Instagram, which is also Meta, which is also blah, 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 all these other companies, or having a Gmail account for the library's email. I'll talk about Google a little bit more in a sec. But one thing librarians really do understand is that if you're not paying for the product, Instagram, it's free. Google, it's free. All this stuff, it's free. But that does often mean that you, the person who are using it, and your data are the product that's actually the reason for the fact that these places are giving away free stuff to begin with. So my library work is helping computer, tablet, phone users do really basic stuff. You know, set up an email account in 2026, their first email account, logging into their healthcare portal. This is the last time I'll mention healthcare. Downloading and signing up for apps, making an account on a lot of things, managing their passwords, and managing cloud storage, which of course is super complicated. I help people sign up for a lot of things, and I help them log into a lot of things. And the level of what I call anti-privacy coercion in these processes that I see every day helping people in the library is, to me, shocking. Every app would like to have access to your contacts. They would like to have access to your location. And if this is a mobile device, that's your location as you move around, not just, you know, me sitting here on my computer in my office. They would like your birthday. They would like your phone number. They would like your address. So that this means that ads and other trackers can follow you around, not only the internet, but into your home. People don't really understand this, and that they also don't understand that maybe they can say no at some point when they're signing up for these things. One of the things that I've noticed is going through like getting an email account flow. Google's like, hey, what's your phone number? Hey, what's your birthday? And a whole bunch of stuff. And there's a big blue button to input your birthday and hit, send. And there's a tiny blue link that says, skip, maybe later. I don't want this. My patrons, it is harder to see. And my patrons often don't have really good eyesight. Frankly, neither do I. And they shouldn't have to in order to preserve their own privacy. I have a patron who I worked with just yesterday. I'm not saying her name because we have privacy laws in the library, which say I can't or shouldn't, who often comes in and she wants help with YouTube, right? She uses it to listen to music and she learns to play it on her piano, or she uses it for ambient music in the yoga classes that she teaches. But if you go for all the default settings on YouTube, which is also Google, which is also Nest, the thermostat company, which is also Fitbit, the little, tracker devices that you can use to count your steps, which is also Waze, the driving directions thing that you can have on your phone, which is also Google Docs, the online word processing that most people use that I've seen. It'll keep track of every video you've watched, how much of it you watched, where you were when you watched it, what device you watched it on, and then what you watched next. And it might encourage you to watch certain things and others, which is a much bigger topic. But if you combine that information with your workout paths, your driving directions, the way you set your thermostat, the words that you process when you're typing, that'll create a fairly complete idea of where you live, where you go, how you like to spend your time, and even how warm you like your living room, which I know we all talk about it all the time in the winter, but maybe I don't want everybody to know that. And so people I see in my work, they often make jokes about like, oh, I was talking about a thing, and then suddenly Instagram is showing me ads for a thing. And they just kind of talk about it like it's normal, but they kind of make that nervous laughter because they don't really know how any of this stuff works. And I try to explain like, well, it's technically possible, but it's likely not what's happening. There's other stuff. But honestly, I don't know either. And my patron doesn't know any of this. And she doesn't know how to change the default settings on her software. So the settings the software comes with, not the ones that you might want. The default settings in most cases are all set for maximal data collection, even stuff these companies definitely don't need to do their business, in all but the most privacy forward companies. Privacy settings are often hidden, layers deep, in menus, which at least on a computer can be really hard for people to access if they even know that they exist, which they almost never do. Especially people with poor motor skills. You got a shaky hand, it's very hard to get to the privacy settings in Facebook. And that also describes a lot of the people I see at the library. So my assertion is you shouldn't need really good eyesight or steady hands to be able to keep your personal information private. And we also know through research that has come out and journalism about this, that even companies that say they're not tracking people are often actually tracking people. We only find out through Freedom of Information Act type of things or lawsuits, and companies just lie about it, and there aren't as many penalties for lying as maybe there should be about what you're collecting and what you do with that data. So one role of government can be to really protect people who are not necessarily privacy warriors like me, who change all the default settings and cover up my little camera when I'm not talking to you. But they deserve to not have their consent violated. They deserve to not have their personal information collected, collated, and shared. Businesses should not actually have been doing all these privacy violations in the first place. So in my opinion, telling them to dial it back should be an acceptable thing, which legislators can do. It's small, but it's important. And this isn't just about Vermont. In this age of extreme concern that private data is being used by public and private entities, in government especially, maybe not our government, but definitely other governments and definitely the federal government, to do things like put people in private prisons or disenfranchise people of color, if you follow the Supreme Court, or control women's access to healthcare, their own reproductive rights, and their own personal medical information. Oh, I did mention medical information again. This is not only the least we could be doing to keep Vermont's people's civil liberties intact, but it also makes a statement that privacy is important and that Vermont cares about privacy. So thank you very much for your time. I welcome your questions.
Thank you. Tony?
I'll ask you what I've asked a lot of the witnesses here. This bill essentially removes the consumer's right in some areas to choose whether they want to opt into anything more than necessary data. Let me say, for example, I have a loyalty program with a restaurant, and they want to give me a free meal or a free appetizer for my birthday. Well, by this law, they can't ask for my date of birth, and they can't ask if I would like to share that information. Do you feel this that we should take away a consumer's right to choose in this bill like we are? And if so, why or why not?
Yeah, I think that's actually, here's what I think. I think any legislation that comes out that's necessarily the result of compromises between people who strongly want two very different things is always going to be slightly broken. It's not going to represent everybody fully. Obviously, I would like free pancakes on my birthday. I think that would be amazing, right? I do also feel that smaller items like, consumer, benefits and coupons and that kind of thing, targeted advertising, I feel like capitalism finds a way. And I feel like this bill is a little bit more about making sure essential, as I understand it, which is some, is making sure sort of people's essential information is not turned into sort of dossiers against them. And if the brokenness of the bill, if what, the 5% that winds up actually being not super helpful involves something like that, I feel like that is an acceptable compromise.
Questions?
Yeah, thanks, Jasmine. I guess I'm curious. I also asked the last witness, the Vermonter that came in earlier, about just the fact. So you said, so people are as far as consent. So you mentioned like there should be basically ramifications for your consent being violated, like, or your rights kind of like being violated. And I'm just curious, like we are with this version of the bill, we gave on we not only like gave on having a private right of action, like an one, but we also made it so people can't access the Consumer Protection Act And this is a consumer protection bill. And so I guess I'm like curious, we have it solely enforced by the AG. And so like so your ability to go to Equifax, for instance, like if Equifax violated your privacy, like I think they fall under certain maybe federal protections that maybe you could sue under that. But say it's another company that doesn't, and they fall squarely under this bill and they have harmed you, and you're not able to, you are blocked from taking that to court under this bill. And the AG, you would have to convince the AG to enforce you, which they said they don't represent individual Vermonters, they represent the state of Vermont. So a case would have to be justifiably big enough to like do that. So I'm just curious how you feel about the fact that you would be blocked from taking people to court if they violate this law, if they break the law.
I mean, I'll be honest, the right of private action would be better in a situation like this, but I mean, and the trickier part, I think, is not so much like convincing the AG that like there was harm or that this was a big enough deal for them to be a part of. I think the tricky part is just that the AG differs, right? Like the one we have now, I think is really savage and amazing at like protecting consumers and taking big swings for the state of Vermont with a lot of other attorneys general, because we need to in sort of what we're dealing with right now. Optimally, you know, the right of sort of some sort of private way of dealing with this would be improved, but also I sort of see what I spoke to the other gentleman about, that like the bill's not going to be 100% of what everybody wants. I feel like the next step then becomes making sure the AG's office has the capacity to respond and represent people in a way that they need to be responded and represented for the spirit of this bill. Like I've had to deal with the AG's office on some specific like legal stuff that I've had to deal with, and I was always kind of impressed and amazed that they were able to deal with me and my weird little problem with my roofer 20 years ago in Topsom, even though I was small potatoes at the time. So as much as being able to do it on your own would be cool, not everyone even has the resources to do that level of stuff, and certainly not the level of skill. It's very hard to access the courts if you've never done it before. Then there's a lot of useful helpers in Vermont, but not entirely. The AG's office does this all day, every day, and I think the trickiest part would be whatever the reflected values are of whoever is staffing and leading the AG's office, making sure they were sort of in line with whatever the thing was that you felt did you harm, right? Because I know some people feel harmed if they find their phone number on the internet. That's not exactly what we're talking about, and there will need to be a little bit of community normative standard about what harm actually can be given this kind of privacy, right? Because all my stuff was exposed in the Equifax breach and like 75 other breaches since then. I'm not sure if I can point to anything specifically bad that happened to me. And I'm also like a lady who's had her phone number on the internet for 2 decades. Creeps don't call me, but that's lucky, right? That's not necessarily the way it works. I'm pleased to have never had a stalker. But that kind of thing is the kind of thing and the kind of edge case that needs to be thought about as you're sort of crafting legislation, right? We see that in tech all the time. Like if you just asked one woman, could a stalker use this? And she says yes, maybe you should think about the implications for the data that your app or your program or your cool new tool is collecting, because a lot of the convenience that we see, you know, Amazon, oh, hey, they totally knew a great book I like to read, right? Because they've been following everything I've been doing for 20 years. That's a weird trade-off. Find another way to find a good book. I know a place.
I get it.
Librarian.
Thanks for telling everybody.
Other questions? Great, thank you for joining us this afternoon.
Thank you very much for your time. I appreciate your efforts.
Zach,
Hello. Always so good to be in this committee talking about data privacy. For the record, Zach Tominelli, I'm the consumer protection advocate for the Vermont Public Interest Research Group, VPIRG. For over 50 years, we've been advocating for public interest and policy debates concerning the environment, healthcare, democracy, and consumer protection. That's why I'm here today, sharing our thoughts on S71. I'll just start by saying we are strongly supportive of S71 draft 2.3 that is before you. I've been in this committee before talking about data privacy, so maybe I'll skip over, why VPIRG is concerned and our work on it. Obviously we supported the data broker bill. And I don't necessarily need to enumerate all of the various harms and concerns that comes with the overcollection and misuse of consumer data. Jessamine just did a fantastic job doing that, and letting you know how that's working. And I'll just say, echoing the same things that Jessamine both articulated to you and what she's hearing from patrons, the same thing that I at VPIRG hear from our members all across the state, Vermonters, whether it's them emailing me, when we talk to them on their doorsteps, when I go into communities and talk to our members one-on-one or at town halls, I hear these concerns about data privacy, about the overcollection of our data, the misuse of our data, who's tracking me, what can be found out. And those concerns are growing, especially with government buying up private data and people being unsure how that's being used. So these are concerns that we hear across the board very clearly. And the other sentiment that I get when these conversations come up is consumers are also overwhelmed. You just heard people coming in and saying, well, how should I do the settings on my phone? How, when I get questions about should I accept cookies, what am I doing there? I know that things are tracking me. I don't kind of know how I'm able to stop that. And I just want you to keep that concept of consumers being overwhelmed in your mind as we talk about some of the details of the bill. And I'm actually not going to talk about a lot of the bill. I'm actually going to focus primarily on the data minimization standard, because I think that is both maybe the biggest, most key component of the bill, what really separates it as being a truly consumer protective bill. And having listened to testimony all week, I think this is the area that I think is maybe causing the most questions, concerns, thoughts, right? And, when I think about the data minimization standard, there's essentially two options, before you right now. In draft 2.3, it has what we would consider to be a strong data minimization standard, essentially saying that companies, would-be data collectors of any kind, should not collect and process more data than is necessary or relevant to deliver the good and service that a consumer is expecting. I'm paraphrasing slightly, but that, basic concept, full stop. Compare that to the data minimization standard that is in, for instance, the Connecticut bill, which we would refer to as a notice and consent sort of data minimization standard, which says companies should limit what they're collecting and processing only to those purposes that they disclose. Those couple of words make a big difference, because that essentially says continue to do whatever data practices you're doing, buy, sell, share, all these kinds of data, but you have to put it in a disclosure and you have to let consumers know. And there is some language in there about how prominent that may or may not need to be. We think that is really ineffective. And I've been thinking about an analogy to kind of illustrate this point. And it's an imperfect analogy, but bear with me. But I'm thinking about other areas where we look to protect consumers or keep consumers healthy, safe. And a thing that I landed on is think about restaurants and food safety. We don't necessarily give consumers a direct right to be not poisoned by food, but we have as a goal for diners to go out and, not get sick when they go out and eat at a restaurant. And we actually do have laws. There's laws that say, lodging and food establishments must maintain a clean, healthy environment. And then that's promulgated by a regime that, does licensing and does inspections and makes sure that all of that's happening. And what that means for me as a consumer is I can have trust that when I go to a restaurant, I might make some superficial decisions. Do I want to go here? Do I like the menu? Does it look clean? But basically, once I enter, I'm operating under trust that, for the most part, that food is being prepared safely, cleanly, and that I'm not going to get sick. That doesn't mean violations don't occur, but we deal with that as they do. That doesn't mean that everybody's complying, but I'm able to operate under that trust environment. If we applied something like a consent or a notice and consent to that situation. What that might look like would be the state saying, we're not going to actually say that restaurants have any responsibility to maintain a clean environment. They can maintain their own standards. They just need to let the consumer, the diner, know, come into the kitchen and put the onus on the consumer to inspect the kitchen and make a determination if that's a place that I want to eat. Now, does that ostensibly give the consumer more choice, more transparency? I guess, but that's not something that I want to do. That's not an operation that I want to operate in. I don't want to go and inspect every single kitchen of every single restaurant that I visit and make a determination. I want to operate under this rubric of trust that the government has said they have to maintain it and keep it clean, and I'm going to be safe. I want to apply that same concept to data. And that's what a true data minimization standard does. It takes the onus off the consumer to exercise their privacy rights, and it puts it on the would-be data collector to make the determination. Is this data that I need? Is it necessary? How long do I need to keep it? And I'm only going to do what the consumer expects with it. And that means, and put it in another way, I think it's even more important in the context of data, because if you think about how often you eat out, I think I eat out, I don't know, maybe a few times a month. Well, I do go to Wheel I Wants a lot, but for lunch, but I don't know, maybe a dozen times. Under a notice and consent framework there, I would need to inspect maybe 12 kitchens a month. I looked, in the last 24 hours, I have visited about 32 different websites. I've used about 8 different applications on my phone, 3 different applications on my smart TV. This is all in the last 24 hours, all for different companies, all different entities that are collecting data on me, all different entities that are tracking my behavior and doing things. Again, under a notice and consent framework, that would mean for me to fully exercise my privacy rights, I would need to read something that, if you add all those numbers up, 42 different privacy policies per day and make 42 different decisions on how those entities are exercising my consumer rights. It's just not workable. It is not really a meaningful protection. Is it more choice? Yeah, but it's too much choice. And this goes to what I talk about when I say consumers are overwhelmed. The current situation puts the onus on consumers to navigate all of these different privacy policy settings to just exercise their rights. So that's why I think a well-crafted, and I think what you have here is a well-crafted data minimization standard, finally begins to change how we're approaching this. It says the company that's collecting your data, they are going to do it responsibly, and they are going to limit what they're doing. And that means I can go to those websites, I can use those applications under that trust. And I can actually patronize those businesses because I just know, the same way I know, or at least think 9 times out of 10, 99 times 100, that kitchen's going to be clean. I know that the company is using the data in the way that I expect. So that's, like I said, it's an imperfect analogy, but I think, thinking about it that way. And so I think I'll leave it there on the data minimization standard, of course. We'll just mention 2 other things and then happy to take questions. One, I think the other really key part of this legislation that I hope to see included in any final version is the ban on the sale of sensitive data. Just some information is far too sensitive to risk falling into the wrong hands. So I would hope to see that in there. And then can't go without just a note on enforcement. I know this is kind of a sided thing at this point, so I'm not actually even trying to say, please put a private right of action back into this bill. I just, as a consumer protection advocate, if I don't make the case for a private right of action, I won't be able to sleep tonight. I'm a freak that way, so I will make the case, but I understand what the committee's preference on this is. And you've heard this before, obviously. These privacy bills are only as strong as their enforcement. The Attorney General's office, their resources are not limitless. We believe that private right of action ensures compliance and provides consumers recourse. And I think an important thing to think about, and again, I understand, committee's preference and how this is going, but just bear with me for rhetorical purposes. It bothers me a little bit that I continue to hear as the argument for dropping a private action that no other state in their privacy law has included a private right of action. And while that's technically true, I would revise that because almost all of those states that have passed state comprehensive privacy laws, almost all of them have underlying consumer protection laws, like we do, that has an underlying private right of action. So it would be more accurate to say that 17 states or 18 states, or I guess now it's 20, that have passed privacy laws have made the decision to take away their consumers' right to a private right of action solely for this law. It's a distinction, but I think it's important to remember that this is a right that exists, that we apply to every single other consumer protection law that we pass, and usually without controversy. Just going through it over the years. We passed a student data privacy law. We passed an automatic consumer contract renewal law. We passed a law reining in the practices of the rent-to-own industry. This body recently passed age-appropriate design code. All of those reference the Consumer Protection Act. All of those maintain the underlying consumer private right of action. It's not that controversial, but I understand why in this context it is difficult and politically difficult to do that. So the last point I'll make on that, though, if the legislature is going to remove the private right of action, to me, that is even a stronger argument to maintain the strong substantive provisions of this bill. Because if the concern was, oh, we're going to have to do data minimization, we're going to have to stop selling data, and if we fail to do that by a technical violation, we might be subject to lawsuits. We are removing those threat of lawsuits. It is fully in the Attorney General's discretion. So maybe this ends this on a bit of a positive note. If you're going to be doing it in that environment, why not have strong consumer protections? The threat of private action has been removed. And in the next couple of years, make sure we have tons of consumer education for our businesses, for organizations, how to comply with this law, and do it with the leeway that the Attorney General's office is going to be limited and have discretion. They're not going to be nailing people for technical violations. Let's move together toward a culture of compliance under strong data privacy laws. I think we can do that. I think we could set an example in this state, and I'm feeling optimistic about it. I mean, maybe after a week of all this testimony, 3 o'clock on a Friday, people are feeling a lot of different ways, but I think it's possible. So that's what I will leave you on.
Does VPER currently comply with what's written out in the House version right now?
Comply, well, we don't share or sell any data. We maintain a privacy policy, and we would respect any kind of requests for deletion or request for data. What we would need to do if this bill were to become law is probably operationalize that in a more formalized way where, if somebody wanted to do a data request, like right now, that would be informal, but we would certainly comply with that. So
How much that would cost to create those features?
That's a good question. I've done a little bit of research into that. There are obviously, and this committee's heard, there's certain free services, but free, you get what you pay for. There's other, different softwares. I think there would be some level of cost. I wouldn't want to put an exact number, but it could raise in the hundreds, maybe a few $1,000s. I'm just ballparking. But I think there would probably be some cost to make sure that we are adhering to all the different rights that people
How
have.
does VPER think about inflicting that upon like small food shelves, churches?
Wouldn't use the term inflicting, but
True. I would, but you would.
Here's what I would say. If any entity is collecting either 35,000 individuals' data or is collecting sensitive data, and listen, I think there can be further discussion on how maybe sensitive data is defined. Are we sweeping up, people that we don't mean to be sweeping up? So I don't know that the book is closed on that. But I think as a principle, if entities are collecting sensitive data, the reason why we're considering this is that we want it to be protected and we want people to have some assurances and some rights and abilities. And even if an entity is somewhat small, and as you've heard from other witnesses, sometimes, unfortunately, the smallest entities, because they're least sophisticated, they're sometimes the biggest targets for various forms of data breaches, attacks, and security risks. So I think we would want them to comply with the law, but that's why I do think it's important. And this committee has considered a longer on-ramp. I mentioned, again, education, providing tools, making that as easy as possible to comply with. to make sure that companies, entities, organizations have what they need to protect our consumers' data.
So you guys collect data.
Of course.
And I'm assuming that part of that collection process is like if you do petitions, which I'm assuming you
Yeah.
do. So you would comply with the requirements. You would have to, because you
Yeah.
collect sensitive data, correct?
Forget about sensitive data. I mean, we have 50, I mean,
You fall into it because you have
we have
50,000.
50,000 members and supporters across the state. So we would be a controller almost no matter how you write this law.
You would support the law that came out of the Senate though, if passed, correct? The Connecticut version.
Well, no.
Support the data privacy bill that was passed out of the Senate? If we could pass that and get it onto the governor's desk?
No, I wouldn't. And then it goes back to that. And probably the major, there are smaller pieces. I'm not going to spend time going through all the smaller parts that I maybe agree or disagree with. Could get over almost all of it. I would say the data minimization standard, that to me is the biggest separation because as it passed the Senate, that bill includes this notice and consent. If that was changed to be a more substantive data minimization standard, then yes, I would largely be able to probably support that. And
Beaver would be okay with not having a data privacy bill at all?
the session,
Versus,
yeah, if you wanted me to rank, I would say 2.3 or something close to it. That would be our preference, absolutely. No status quo, no data privacy bill, come back and continue to work for something strong. That would be the second preference. The third, I wouldn't even call it a preference. The bill as it passed the Senate, we would oppose that bill. And the reason being, I'll explain why. The rights that it essentially gives Vermonters, these basically consumer rights, because these have been propagated in so many other states, most of the largest data collectors are already offering these rights. You're not actually effectively giving consumers any real additional protections. And by repeating that weak data minimization standard, you are now putting that in law here. And for anybody that is considering trying to make that stronger, make that more substantive, say, hey, restaurants, your kitchens need to be clean. Hey, companies, you need to minimize your data. You are making it that much harder for anybody to try and move forward because another state has repeated that. And I really support that.
you're saying, because I look at that as your VPIRG would be supporting, giving up the good for the perfect in their mind. And
My contention there is I wouldn't describe S71 as what passed the Senate as good. I would describe draft 2.3 as good. And I actually meant to start by noting this body passed and it was vetoed and it was not, overridden, but passed a law that was much stronger than draft 2.3. This, in my mind, already represents a fairly significant compromise in terms of protecting consumers. So
2 years ago.
2 years ago, correct. Yeah, 2024. So, I said we support this. This represents a fairly significant compromise in my eyes in terms of protecting consumers.
But to say, I don't know if I would say, you're saying it's a compromise, but there's people that I'm not suggesting I'm one of those folks. I actually support the S71 as it came out of the Senate. You probably could do the additional amendments that have been passed, but I just lost it just as I was saying it. That's really unfortunate.
It's Friday.
It's Friday. It's Friday at like 3:15. It seems odd that, okay, yeah, we're talking about, coming halfway. There are people that don't want anything at all, right? So you're halfway, what you're saying is halfway. I think I'm not sure that's really fair to everybody else that doesn't want anything, because then Because that, to me, that just feels like just pushing the envelope on that. But I think that we should do something. I would, like I said, you know, what's already passed in law down in Connecticut, but you're saying that you would support.
Correct, yeah. And, you know, I mean, I don't know if I would characterize that as fair or unfair. I just, without,
Well, it's opinions.
yeah, exactly. And without a somewhat stronger data minimization standard, my analysis of the bill would be that you are not effectively giving consumers in Vermont more rights than they practically really have already at the moment. And you are then codifying a data minimization standard that continues to say companies, any would-be data collectors, can continue to collect data and continue their data collection practices with no changes, provided they include what they're doing in a privacy policy. And that, in many ways, is worse than doing nothing. At least that would be from our perspective. Yeah.
What you're saying though is that Connecticut, okay, that's fine.
Yeah, I think we,
That's fine. I'm on that.
over and over.
That's my opinion and my analysis, and we can talk. No problem.
I'm gonna ask a question
Yeah.
similar to what I've asked
Yeah.
before. Not gonna debate, just
No.
want your answer.
Totally.
You are a consumer rights
I-
very much
Yeah.
advocate.
Yeah.
So reconcile for me why you're such an advocate for consumer rights, but yet when it comes to allowing the consumer to choose what to do with their data, you are against that right, because this bill essentially eliminates their ability to do that.
I wouldn't agree with that characterization, but I understand and appreciate the question. I want to remove the onus of the consumer to exercise their privacy rights, but I believe that this bill still preserves a lot of choice. Just as in my analogy, I can still decide what restaurant I want to go into, want to patronize. I don't need to be able, or I shouldn't be required to be the same person who's then also inspecting a kitchen and making sure that it's clean. I similarly have the choice of what websites to visit, where to go to search. I just want to know that that is backstopped by a standard that says when I go there, they are treating my data in a way that I expect, and not beyond that. Similarly, you know, you raised the question previously about, you know, the loyalty program, and you know, maybe I want to give them information to get discounts. One, I have to double check. I don't have the entire bill in front of me. I think there is some language in there dealing specifically with loyalty programs. And even if not, again, a data minimization standard is not meant to be completely handcuffing or not allowing those types of things. That loyalty program would be a service that you are offering the consumer. And if you were offering them free pancakes on their birthday, you would reasonably need to get to their birthday to provide them that service. That's all that the data minimization standard is saying if you're going to provide a service, think about what it is you actually need to provide that service and don't collect any more. So if I want to offer a free pancakes on a birthday service, I need to collect a birthday. Yeah, and I'm not disagreeing with that. That's fine. But you can offer that to consumer. So I don't see this as limiting consumer choice. You may disagree on that, but I don't.
Oh, it's great. That's a good response. Like I said, I asked the questions to get the answers, and we'll deliberate later.
Thanks for being here, Zach. Appreciate this. I've been for a long while, I've been struggling with apps that require you today to consent to their privacy policy in order to use the app and have access to it, including Gmail, right? And so they get to choose what of my data they want, they keep. I don't get to choose that. And that's part of that opt-in, opt-out for that service. And, you know, there are a number of apps that would make my life much easier that I have chosen not to have access to because of that. And so I'm curious how you see that changing. If we go to a minimization standard, would that cause Vermonters not to have access to some of those apps? And this is, you know, crystal ball, right?
Yeah.
Or, you know, reasonably I guess, yeah, reasonably likely, reasonably associated with business collecting data. But also, is there a way, right, to say, I don't know. I'll leave it
Yeah.
there. I have so many thoughts that I
Yes,
just don't know.
it's a great question. And so the first part I would say to that is what you would hope if you put a strong data minimization standard and that most companies would comply with that. And I think the goal is to get past what you're describing, which is instead of either having to, as a consumer, understand how they're using data and make decisions, or even being forced into you either use it or you don't. Again, we go into that, call it the circle of trust, where I'm going to use the app. They're not even necessarily asking me consent one or the other. I just know because of the rules of the road, because of the law that's in place, that they're only going to use the data in ways that is necessary to deliver to me. So that's what we're trying to achieve. And that's why you would want to do that. It does reasonably leave open the question, well, if you're a company that produces an app and you produce it maybe all across the country, and you want to, be able to suck up a bunch of additional data and sell it and monetize it and do things that would not conform with data minimization, why you make the decision, well, if I do that, and Vermonters, if they pass this law and they find out, the attorney, now again, there's no private right of action, so a Vermonter wouldn't be able to hold you account at all. But if the attorney general was going to, you might say, I might not want to offer that app in Vermont. That's almost a question that comes up in almost every consumer protection bill. If we add in this, particularly consumer protection, it's going to cause a business to have to change something. Are certain businesses not going to offer things? And it's impossible to answer. Some may not. Sometimes we've seen threats to do that, and then they don't. We've seen it with like labeling laws, all these kinds of things. Forgive me if I've marched this out in this committee before, but again, to me, it comes down to the substance and what the protection you're trying to put in, and is it worth it for Vermonters? And I guess I'm all on the analogies today, but if you passed a law saying we're not going to allow orange juice companies to sell orange juice that have arsenic in them, that's the consumer protection. And Big Orange Juice came in and said, well, we're going to stop selling our orange juice with arsenic in Vermont. You would laugh at them. You would say, yeah, please stop selling your orange juice with arsenic in Vermont. So if a company is not going to adhere to data minimization standards, if they're going to suck up Vermonters' data and sell it all over the place, they say, well, we don't want to adhere to your law. That may be a decision that you might say that protects Vermonters, and it's not always that crystal clear. I know but that's
the particular one that I'm thinking of is an international company,
Yeah.
so they already have to provide this service to Europeans.
Yeah.
They already have. So of course, they're still going to provide it to Vermonters.
Yeah.
So, and I think we're going to probably find that over and over again. It took me down this thought exercise, listening to these conversations, having these challenging debates, and really to get there, because I feel like we don't want to think about this all the time. I mean, we have been all week, every day, all day, even in our sleep. Yeah, it's not simple. And I think that's part of the issue, right? This is complex, and, we are one of 50 states, a small one, and we're trying to protect our citizens and figure out a way that we don't overburden our businesses in that process. And it's not simple.
And to that point, and one other point I wanted to make, or maybe even a correction, I think I at one point said, you have two options before you in terms of a data minimization standard. What you have in 2.3 and the Connecticut version, which we would not support. I think that's inaccurate because that's not to say I've heard a lot of concerns, and I think some of them, well-founded about, well, we're confused a little bit by how this data minimization standard is written. Would it allow us to do X, Y, and Z, this particular type of targeted advertising or this kind of communication with a customer? We don't think that would be harmful to consumers, but we're worried that it wouldn't be allowed under this data minimization standard. I'm not saying that what you have in 2.3 is a stone tablet that cannot be changed. I mean, I think if there are ways that minimization standard could be made more clear, could make it so that companies can do things that aren't going to cause harm to consumers and they can feel assured that they'll be able to continue to do that. This committee should absolutely have those discussions and change that. It's more the principle of a minimization standard that actually requires some minimization versus a standard that says, do what you want so long as you disclose it. Those are two different models. We cannot support the disclosure model, but that's not to say that this is the exact perfect way that one could write a minimization standard. There may be other options there.
How do you see the transfer of sensitive data from 501c3s to 501c4s in organizations such as VBERG?
Transfer of data?
Because I mean, if you collect it under the 501c3, you're probably transferring it over to the 501c4, correct?
Yeah, it's collected as one item. I mean, in terms of that kind of data, people usually we're talking about a donation is really the one way that you would see a distinction there. And if somebody donates and they want their donation for the 501c3, then it's designated as such and kept that way. So there's not a transfer of data so much, but so I don't know if I'm maybe not understanding, but yeah, there's not a transfer of the data.
Does the 501c4 have access to the data in the 501c3? As most 501c3s and 501c4s, they also share space, computers.
So exactly. So we share space, we share a database. So it's a single database. So there's not a transfer of data.
If you collected, okay.
Yeah.
I mean, if you collected under the 50c3, because if you're going door to door underneath the 501c3, and you're transferring.
Well, we don't go door to door to the 501c3.
Right, it's transferring. I'm curious, but that's okay.
Yeah.
Right, thank you.
Thank you.
Anything else you want to take up?
Do we have time for both discussion? Something?
Oh,
Something?
something.
I was gonna say, are you kidding?
Time or mental capacity?
Yeah, exactly.
It's been an interesting week. So. Again, aspects of different data. Languages that are other on. Start working on that.
And just if you see TBD on our calendar, it means we really haven't filled it in yet.
Right.
We'll fill it in as we go during the week. We just don't know how long some things are gonna take. So don't get too excited if you don't see the calendar that you did.
So you know, H648 has second reading, that's the fire housekeeping bill. Today, it will be up for final consideration on Tuesday, which means we'll probably get it till the end of the week. Working on a amendment for that, send back over to the Senate. Dealing with these, they call it. Right, was merchant cash advances. Similar to a payday loan, payday cash advance, but they're targeting merchants now. Businesses. They've been going on, I get them. Qualified to receive up to $200,000.
Oh, yeah.
Here's what you have to do and sign up for that and they start pulling money out of your account. From your receipts every day, they're not licensed.
Those have been around for a long time.
Yeah, so I think it's time for us to,
Yeah.
such as we did with license lender. We're gonna provide that service until not being done. So, yeah, I already got some language up, it's sent over to Maria. So we'll pick that up. Fill that. Discussion well. See whatever else comes back over to us if they will. So with that, many questions? Everybody have a good weekend, get charged up again, have an enjoyable week in Congress next week. We go as well.